I'm Dr. Dona, and today we're going to be diving into a topic that is close to so many of us and we might not even realize it. And that is, what is autism and how it can present in children and adults. Whether you're a parent, a teacher, or just curious about what autism is in general, understanding what autism is can actually help make a world of difference in a child's life. But did you know that autism can present and look completely different from one child to the next? Today, we're unpacking what autism actually is and just also beyond the stereotypes and exploring how it shows up in children in some amazing and sometimes unexpected ways. Let's get into it. Let's start with the basics. Autism or autism spectrum disorder affects how people communicate and interact with the world. And it's called a spectrum because no two people experience it exactly the same way. People often think of challenges with social interactions, repetitive behaviors, or sensory sensitivities. But did you know that there are also subtle signs? Let's go over a few now. Here are a few uncommon signs of autism. Number 1, difficulty with unstructured play. Many kids on the spectrum may struggle with play that doesn't have a clear goal. For instance, they may excel at building with blocks, but find it hard to engage in make-believe games without rules or structure. Number 2, another sign is hyper-focus on specific topics. You might notice a strong interest often in specific areas like trains, animals, technology that seem more intense than their peers' interest. For adults, this can show up as highly specialized knowledge and almost encyclopedic in nature. One thing that I've noticed is that I will ask patients, oh, do you have a specific topic or that you are an expert in? And a lot of times people with autism will say, oh yes. And I've had children say, oh, I love dinosaurs. And they could talk to me about dinosaurs for 30 minutes. So these are small things to kind of pick up on. An additional sign would be sensitivity to change in routine. While it's known that people with autism can be routine-oriented, some might have very specific routines that they rely on to feel comfortable with. Even a small change, like moving dinner by 10 minutes, can cause a lot of distress. Well, I'm going to say honestly, people in general struggle with adjustment and changes, but it's just that much more problematic for people who struggle with autism specifically because they are very much ruled by wanting to maintain structure and routine. Now here's an uncommon one. Difficulty with abstract language or jokes. Many people on the spectrum might interpret language quite literally. Phrases like, it's raining cats and dogs, or sarcasm might go over their heads. This isn't just a quirk, it's a genuine processing difference. So sometimes people with autism might say, oh, I didn't get that, or they might not be laughing when other people are typically laughing to a joke. And this is something that people might not pick up on right away, but there can be a lot of times concrete thinking that happens because of the way that their brains are interpreting information and processing it differently than other people who aren't considered neurodivergent or autistic. So let's talk about sensory sensitivities, but specifically, let's go beyond loud noises and bright lights. Some people might be extremely sensitive to textures, like fabrics or even food textures. This is why food selectivity is common, especially in children. It's more than just picky eating. Certain textures might actually feel overwhelming and cause additional distress to the child, which leads to further avoidance of specific foods just because of the texture and then the color. And here's another interesting one. Challenges with predicting social cues. Many people with autism might struggle to anticipate social reactions. For example, they might not notice when someone is getting bored or angry in a conversation. It's not intentional, they're not doing it directly, it's just a different way of reading social information. And again, this comes down to how their brain is processing this information and interpreting it, which is different than people who are not considered autistic. Something that I touched upon earlier is a sign I see a lot in my adult patients, which is intense focus or burnout in high-stakes situations. Adults with autism are highly committed to their work or hobbies, but they can experience burnout if they push too hard without breaks. They are able to hyper-focus, but then a lot of times that can lead to too much hyper-focus, so they're not recognizing that they're actually neglecting their self-care and their needs, leading to burnout. So why am I sharing these lesser-known signs? It's because autism is often misunderstood. Many people go undiagnosed, especially if their symptoms don't fit the typical mold. Autism can be subtle and look different in everyone, especially in women who might mask their symptoms more effectively. So a lot of times with children and girls in particular, it might present differently than with boys. And a lot of times these symptoms might be a little bit more subtle, but the awareness of these signs and symptoms in general can help with diagnosis. So if any of these signs resonated with you or someone you know, consider reaching out to a professional for an assessment. This can be a psychologist, a child psychiatrist, anyone who can help perform diagnosis on autism, including ADOS testing. And just know autism isn't a bad word. It's simply a different way of experiencing the world, and with the right support, people on the spectrum can thrive. Thank you for watching. I hope this was helpful for you to see autism in a broader light. Don't forget to like, subscribe, and share if you would like to see more videos on mental health topics, and drop a comment below. What other mental health topics are you curious about? Let me know, and I'll see you next time.